Hi, what's up, guys? Welcome back to another episode on the show Behind the Scenes in Hell with Dr. Ron. And on today's episode, I'll be talking about the top ways in which social media can actually advance and transform your career as a healthcare professional. If that's the kind of content you're looking out for, or you're interested in this topic, then you just want to stick around to the end of this video because you don't want to miss any of this tips. Hi everyone, my name is Ronald. If you're new here, thank you for coming up. If you're a returning subscriber, thank you guys for sticking around and supporting the good work we do on this channel. I host this podcast on a weekly basis and I talk about healthcare, I talk about health tech, and I'm particularly very big on alternative careers, especially for those who are tired of bedside. So if that's what you're looking for, don't leave without subscribing. In fact, just take a pause, pause this video, subscribe, then you can start watching the video again. So without wasting time, let's get into today's conversation. So the big topic is how can social media transform your career as a healthcare professional? And it can do this in so many ways, because I know a lot of colleagues who their careers have been transformed by just being on social media. In fact, we are planning a series about this where we'll get to talk about different professionals who have actually had their life transformed by just being on social media. So you don't want to miss that. So way number one, it helps you to build a professional network quicker, stronger, and probably more efficiently. Now, the thing is this: being on social media, or social media generally, has broken the barrier to almost zero as to how you can reach out to people. I mean, please reach out to them politely. So because nowadays you can send people Twitter or X messages or DMs. You can message people on LinkedIn, you can message people on Instagram, you can message people on Facebook. And this was not the case before. Imagine if I wanted to reach the CEO of a company, I had to get through so many hoops just to get a word or a letter or a mail to the CEO. But that barrier has been broken down now. So you're able to connect with more people who share diverse interests in your area. For example, in the health tech space, informatics, and I'm beginning to build the network in that area, people who are also working in the health informatics space. So it's a good way to connect with your peers in the industry, reach out and connect with industry leaders and potential collaborators to foster good professional relationship and also stay updated on trends in the industry, right? The next point is a good avenue for informing and educating the audience. Now, a lot of people are on social media these days. I mean, we're in the digital revolution, right? And with that comes a lot of, I keep saying now, a lot of persons are doctors in quotes, putting out false content that is not verified or authentic. So it's also the opportunity for healthcare professionals, to come online and educate people, give them the authentic content that is confirmed, that is verified, that is authentic, that is credible, and that can save their lives. Because by busting one myth that has been pushed out there, you're saving a lot of lives, right? So it's a good platform to educate and inform people, therefore thereby ultimately promoting better health literacy and disease prevention. So you see the likes of Aproko Doctor with his very witty videos. You see people like Olawale doing his world rounds. There is Dr. Kelechi Okoro, that's Health Athena. There is Dr. Zubo, Choma Wakama. There's even myself. Why did I call myself last? Anyway, there's even myself. I used to do Tales of Dr. Ron, where I try to spin stories based on symptoms and signs of disease and what you can do. But I mean, I got busy with school and all of that. So hopefully I should come back with writing the stories. So those are ways you can inform and educate the audience. So this now neatly ties into the third one, which is improving your visibility as a person or as a brand, and also your credibility. So what happens is, by the time you're consistently pushing out all of this content, people start seeing you as an authority, somebody that is credible, somebody that can be relied on, because you identify as a healthcare professional on social media, right? So what it does for you is people now start reaching out to you to work with you. And working with you doesn't come for free, right? So we'll get to that part anyway. So They just see you as a trusted authority in your field because you're always sharing valuable insights, you're sharing research findings, you're sharing evidence-based practice. I know a couple of handles on different social media platforms that just dedicate themselves to sharing insights from research, summaries, and all of that. And that's a good way to promote yourself, push out your credibility or enhance your visibility on social media. So by the time you're doing this, what happens, it leads into the next steps, significant financial rewards. So a lot of brands begin to reach out to you. Look, Dr. Ron want to work with you, Apoko want to work with you, and it's not for free, right? So they can work with you in different ways, either to make videos, either for you to anchor events for them, maybe on Spaces, Twitter Spaces, or Clubhouse, or it could be to be a panelist on a panel session at events they are organizing, or feature in a commercial they are shooting, or to promote a product. It could be in any way, but bottom line is it is not for free, and a lot of them actually pay quite handsomely. This is another conversation for another day. So, but it's a good way to significantly, up your finances if you're on social media. But I mean, you need to be doing the right things for you to get to that point, right? Now, the next way is to talk about your patient engagement and support. So this goes in well for people who run hospitals, right? So social media is a good way to support patients by giving them accurate, timely information about what it is they are suffering from, what their healthcare concerns, and thereby fostering a sense of trust and rapport with them. Because I mean, the tides are changing now. So I know hospitals who have WhatsApp groups for maybe pregnant women, WhatsApp groups for what do you call it now? People maybe with heart failure, or name it, whatever kind of illness it is, there's a support group. So that is the way things are changing, and trust me, WhatsApp is also a form of social media. Then another way of your career being transformed is social media helps you keep abreast of industry trends all the time. So that I'm on social media now, there are different keywords I track every day, or there are different handles I follow. For example, you follow WHO, you follow CDC, you follow UN, UNICEF, all those big health bodies. So as the news is usually breaking, they are usually the first to report it. So it's a good way of getting first-hand information, because it's difficult to read all the papers and monitor everything that is really happening in real time. So social media is a good way to just keep a tab on what's happening with the industry and what changes are going on and all of that. Then you can also use it for public health advocacy, social media campaigns to advance whatever cause it is for you. So for example, during COVID-19, people did a lot of campaigns to drive vaccine uptake, or there is a cholera outbreak, or there is Lassa fever outbreak. So there's usually this mass effect on social media. So if you really want to get to a lot of people, social media is actually a good place to use to push your advocacy and social media campaigns. But the only thing is just make sure it's proper, it's accurate, and it's done properly, within the limits of what happens on social media. I made a video the other day about, things you should avoid as a healthcare professional if you're on social media. So you just want to probably look for it on my channel and watch it. Then the last but not the least is professional development. So being on social media can help you expand your knowledge, enhance your skills, and stay connected to the broader healthcare community, because most times you probably attend an online webinar, you communicate or participate in online forums where you share your thoughts or experiences in your practice and all of that, or just generally just listening or read other people's conversations. So that way you're typically almost getting insight as to what's happening in other parts of the world in terms of practice. Maybe I'm here in Nigeria practicing as a doctor. I see what's going on in Japan. I see what's going on in the US or in the UK and all of that. So it's a good way to professionally advance yourself. Now, some of those platforms too also offer CPDs or CMEs, which you can benefit from. So some are paid, some are unpaid. But you have the opportunity to utilize all of that in your career, right? And so that's usually some of the ways social media can transform your life. But for me personally, I would say, how has it transformed my life? So I have a bigger network now. A lot of the people I work with now, honestly, I haven't met them in real life. I met everybody on social media, and when we talk, it looks like we've known actually for a very long time. But I met all those people on social media. Most of the brands I've worked with, I all met them on social media, right? Because they saw me as somebody credible and putting out the right content, come and host spaces for us and all of that. So that's social media. And ultimately, I got some money in my pocket doing all of these things on social media, right? So what's stopping you from getting on social media? But you have to do it the right way. So I don't know what your experience has been with as a healthcare professional on social media. You just want to let me know, just drop it in the comment section. Like I said, we are going to spin this off into a series where I bring a lot of persons who have had significant experience on social media, and they come and share with us how it's helped them. And probably you might just pick one or two things from those conversations. And until I come your way next episode, I still remain your host, Dr. Ron. Don't leave without subscribing, and bye for now.